This is a hip abduction series or an isometric series for those dealing with glute medius tendinopathies or tendonitis. The version that you see on the left here is the simplest, least aggressive version. The version you see on the right is the most aggressive. You're going to start with whatever you're currently capable of doing on a comfortable basis. You have to hold this exercise for 30 seconds to a minimum, 60 seconds to a maximum, so anywhere in between. If 60 seconds is easy, then you need to progress the exercise and make it more challenging. If you can't get 30 seconds, then you're probably making the exercise too challenging. You need to find that sweet spot in the middle. What that does is it fatigues out the healthy portion of the glute medius, or the area that's injured, because the body is going to use the pathway that still does have integrity. When you fatigue the portion of the tissue which still is healthy out, then it starts actually loading and stressing the injured tissue. And that's the purpose of isometrics, is loading the injured tissue. And you have to hit a duration that fatigues the healthy portion of the tissue so you can actually get into loading the injured portions of the tissue. So going left to right here, the easiest version is band around the knees, laying on your back and pushing out wide. Now, if you're on the ground and you have your shoes on, you need to have some sliders so that you can actually slide out into the ground to reduce the friction. If you take your shoes off and you just go on carpet and slide your socks across the ground, that's fine too. Again, the point is you need to have no friction, because if there's friction, it makes it a lot easier to hold that enraged position. Now, advancing beyond that is you put the band around the ankle. You don't need to go super wide into the splits, just basically getting your legs out at 30 to 40 degree angle. Now, if that gets easy for you, you can obviously keep progressing the band resistance, but then you could also challenge it a little bit further in side lying and going against gravity. You can, again, put the band around the knees, which would be the easiest, less stressful version, or you can put the band around the ankles, and now you have to lift with a straight leg. And I like the band being slightly in front of the body, as seen here in the video, so that you can push up and backwards. So you get a little bit of hip extension isometric out of the exercise as well too. Just a little bit of an added bonus there. And then finally, the most challenging is the side plank, laying on your side. Going from the knee is the simplest, and then you can progress that to a full side plank with just the bottom leg on the ground. The reason why we just do the bottom leg is because the glute med will be the limiting factor, as opposed to if you go both legs on the ground like a typical side plank, your abs and upper body are going to be the limiting factor in how long you can hold this. And again, we need to search for 30 seconds to 1 minute as the goal range, as the goal time frame. And so there's ways of progressing that exercise further and further. You could even hold a dumbbell on the side of your top hip to make this exercise even harder from a loading perspective. And then finally, if you want to add a little bit of dynamic motion, obviously we can move the bands in and out and start performing an isotonic exercise, or we can do a pumping side plank where you pump up and down through a range of motion, which adds, again, more of that isotonic contraction, which eventually we need to get to. We don't want to just stick to isometrics for the rest of your life. We have to get the muscle used to contracting as well too. So don't forget about other exercises that can be useful that take the muscle through a full range of motion, both concentric and eccentric contractions. But commonly, isometrics are going to be your starting point and something that you should do daily until your pain starts subsiding and eventually have no pain whatsoever. And as far as an injury prevention standpoint, that's more just good training through full range of motion, but you could use isometrics every once in a while. But usually once pain goes away, I stop doing isometrics much more infrequently. If you'd like a full-fledged workout program for your hip to see how we integrate these exercises and others into a full-fledged workout program, be sure to check out the link down in the description below, and you can check out all our workout and rehab programs.